Dr. Kourakin, I hear that there is millions, I think it's 40 million, doesn't really matter, of people running around with a denture. And they all seem to have a few problems with it. They're acting like with my trousers. I keep telling my wife that my trousers shrinks, and she says, no, honey, your belly was growing. And the people claim that their dentures are getting wider when really it is their bone which are shrinking. Anyway, you need to put glue in it in the denture to glue them up. You lose your tasting, all kinds of things. And very few people seem to be reaching for this hybrid of denture, which is an implant-supported denture. Couple implants, maybe 3, maybe 4, maybe 2. But either way, all of a sudden you have the benefit of an implant and still get all your mouth, meaning the price difference is apparently huge from a lots of implants to just the implant-supported, and yet the way it fits seems to be enormously above a normal denture. Anyway, tell us about it, and is this really kind of an upcoming and not yet noticed type of technology for all those people out there running around putting Fixatent into their mouth every day?
Helmut, I would have to say that probably 90% of the population absolutely dislikes their lower denture. The lower dentures are a damnation. The statistic, I believe, is approximately 50% of the population over the age of 50 has one denture, either an upper or a lower. That's a horrible statistic, but that is the statistic.
Really?
So the implants, yes.
Half of people over 50 have a denture?
Over 50 have either upper or lower denture, or at least have so many teeth missing that they should have a denture, but maybe they didn't get a denture. People walking around without teeth all the time, even more sad. But an implant-supported denture, Helmut, is the way to go. Some dentists call them high-water dentures because what happens is you'll have maybe 2, 3, 4, or 6 implants located in any region of the bone where the bone is strong enough to support the denture. And then it's a male and female connector so that the implant will then actually lock over top, or the denture actually locks over top of the implant to the point where they can be screwed down into position so they don't come out at all. And now we have a full complement of teeth. Or sometimes we can place these gaskets and these O-rings that will lock onto the implants, and then it actually takes 2 hands to push the denture out, so it will stay put through no matter what you eat. So there's many different configurations based on the bone that the person has, and based too on how much money they can afford, because the more implants they have, the more secure it is, and what kind of a denture do they want? Do they want it permanently screwed in position?
Let me take up a point there, because obviously, well, maybe not obviously, but I assume that lots of time, if a person has a choice of, 20 implants, if he has the money, he probably would do it. So I assume a denture to a certain degree is a money situation, right?
Absolutely. Now, I see that so often.
Right. Now, and I do, however, and of course years ago, implant-supported denture wasn't around. So bang, that was the way to go. So now you just said 2, 4, even 6 implants. Obviously that does bring up the price. Question. Could a person who is, let's say, a little bit low on money say, all right, let's go with 2, and in 8 months or in 6 months, whenever, I have a little more money, we can augment and put 2 more in it, and maybe even another 1 or 2 down the road, and you can plan it like that. Is that a possibility or not?
Helmut, you're right on the money once again, Helmut. I think you've been studying some dentistry on the side.
No, my past lifetime, I had a really bad mouth, and I got all kinds of treatments.
Yeah, right. You've been down that road, right, Helmut? But yes, we can stage it, that we can place 2 implants. Like some folks come into my office and their insurance will only cover so much work, but they want a product at the end of the journey. So we will start out with 1 implant and then 2 implants. And now once we have 2, then we can lock the denture down. And then later on, if we know that this is where we're going to head, we can structure the denture so that 3-4 years down the road, we will have a complete service, a complete product here, and we will not have skipped a beat here. And we'll been able to have staged it, working with people's insurances, working with their financial situation, giving them what they want instead of demanding that they go with 6 implants right away, because sometimes it's just not financially feasible for individuals, especially during this very difficult economic time here.
Right.
So I'm very okay with that.
Beautiful, beautiful. Now, another question. You know, it's a world of difference apparently. So just a straightforward question. If I have an implant supported denture, can I chew on a spare rib at the 4th of July? Can I bite into an apple? Yes or no?
Absolutely, yes. And the corn on the cob and the carrots and the crusty Italian bread and the Jewish bagel and the whatever.
That's simply something you cannot do with a normal denture, right? I mean, it's just not going to happen.
It's not going to happen in probably 95% of the cases. That is correct.
And once the person has this denture, if he can chew on a spare rib and bite it on an apple, I'm almost sure that he will, you tell me whether I'm wrong, that he will never anymore have the feeling that when he laughs that his dentures might come out. I'm not even saying they will come out, but you know when you wear shoes which not quite fit or whatever it might be, you just feel very uncomfortable. You know, they're not really coming off, but they feel like, and you start walking like you're walking on eggs. I'm sure there's lots of people like on a Thanksgiving dinner or anywhere for that much where there's people and they kind of, because they're not sure it will come out, and that feeling will be gone. So self-confidence will be restored with a couple of implants there, right?
Totally, Helmut. And, you know, I can tell you this. We practice outside of the shore area, Atlantic City, Ocean City, along the beach area. We have many guys that go out fishing, and quite often the seas get rough. And quite often when the seas get rough, they get sick. And when they get sick and they vomit and their denture goes flying into the Atlantic Ocean, that's a situation that's very precarious, because now they have no teeth. They've got to come in. It's going to, even though we have our own dental laboratory, we make our own denture on the premise. I have my own laboratory technician. Her name is Bobby, with 25 years experience in manufacturing dentures, and she is a gem. We will make the denture as quick as possible. But here, if it was implant supported, there would never have been an issue.
If it wouldn't be so funny, it would really be sad, you know?
Yeah, it's sad. It really is sad.
Yeah.
Or people that go to the hospital, even worse, and they lose their dentures in hospitals because they were critically ill, and the denture is misplaced or thrown out. And next thing you know, they're coming back from the hospital, or they're in the hospital and they can't chew, and the doctor's saying they're losing weight, but they can't eat because they lost their denture there. Now what do? Another difficult situation. Nursing homes lose dentures there. People lose dentures all the time. They wrap them up in napkins at McDonald's and they throw them out into the trash because it was more comfortable for them to eat that hamburger without their teeth and put it aside, and then they lose them. So
unbelievable.
Makes no sense.
So the denture thing is that the implant-supported denture, the hybrid denture, as I personally call it, is definitely a great thing, and it's very, very affordable because there's so little extra needed. Let's just say a person has a pretty good denture. It fits him pretty well. It's not that old, but it's a normal one. Could he put an implant things on there, or do you have to make him a brand new denture and charge him money for it, or could he actually maybe use that old denture in some cases?
In some cases, it can be used. It depends on the location of where the implants need to be placed. It depends on how much height there is in a denture, how much room I have to work within the denture. So an existing denture, we would have to examine the situation. If I know going forward that the person cannot afford implants immediately, but would like to have them someday, I will, in a blueprint of the denture, I will actually create the space necessary so that 5 years from now, they can come back to me and we'll put that implant in and we'll be able to use that same denture and won't cost them any additional money.
Well, the way I look at it, it's a matter of, confidence. I mean, I grew up in Austria and we had this saying, Kleider machen Leute, basically means clothes make people. And whatever truth is to it, the truth is when we do put on a new suit, a new tie, new shoes, we do walk a couple inches taller. And I can only see how important that is when you have that natural. I mean, there's nothing more natural than having this grade. Do you know what I mean? So by now, dentists fix headaches. Dentists, prevent kidney failure and stillborn babies, name it, because of gum disease thing. You guys fix ugly-looking faces because of caved-in faces, and you make people more confident. I mean, anything you guys don't do?
Let's see. I don't do stand-up comedy there, but we do make people laugh because they do enjoy their teeth.
People laughing at the dental office. Yeah, right. All right. Dr. Kourakin. Bye-bye. Thank you very much.